Hi there, everyone. This is Dr. Schroeder with this week's video introduction to week number 6 of our course in advanced pharmacology. And been away from the video here for a couple of weeks, so of course this week we picked up again with our team discussions. And so I want to thank Allison, Janetta, and Olga for leading the discussion this week. And the discussion topic, of course, is we're looking at endocrine system, and specifically this patient that had issues dealing with diabetes and diabetic ketoacidosis. Some very nice discussion also. Some great research was posted. Some very interesting topics and subthreads were brought out. One thing that I would highlight, having reviewed these threads, and I'll be giving feedback and we'll be grading them no later than Monday, probably Sunday night, but probably really, maybe Monday morning. Really important with when you're talking about DKA or any patient that has diabetes, education is probably the key. The medications are great, the medications that we use and the pharmacology that we use, but those medications are only as good as patients' compliance will be. And this was addressed in several of your threads. The topic of how to provide appropriate education, how to provide appropriate case management. These are all really important, particularly when we talk about pharmacological interventions in a nurse leadership role. So that's just one thing that I would like to point out, and one thing that I want to highlight that was really, I think, important and very rich in this week's discussion. In week number 7, we're going to shift focus now. The same pattern, pretty much the same thing we've been doing in these discussions, except the focus is going to be respiratory ailments and pharmacology dealing with respiratory. And I'm going to have Sheena and Ang are going to be leading the discussions this week. Only 2 members in this particular group, so you're going to see me probably a little bit more active than usual in the actual discussion itself, just to kind of make things a little bit even and to make things a little bit more fair so that everybody gets the appropriate amount of discussion response, the appropriate amount of moderation without putting an undue load on a little bit of a smaller group. But otherwise, the pattern is exactly the same. Remember that the discussions initial posts are due by Wednesday. All the follow-ups need to be completed by Saturday. And then the case study and the peer evaluation will be turned into the assignment manager by Group D no later than Sunday night. And of course, if you have any questions, go ahead and let me know. The only other thing to pass along this week is remember that in week 8 you do have your final exam. It's just like the first exam. The difference is it is a much narrower actual testing period. The first test had a fairly long testing period over a few days. This next test is only going to be open on Wednesday and Thursday. It's going to open Wednesday morning. It will close Thursday night, and that's because the actual final day of class is actually by Wednesday. Your actual final grades are due in class by Wednesday. So otherwise, it is the same basic way, the first test that you had, the same type of test questions, just on the materials that have been covered here in the second half of class. But be aware of that. It does have a limited window. It will be Wednesday and Thursday. So make sure that you have time in your schedules to take that test as many times as you can, or to allow yourself multiple times to take the test in that test window period. It is indicated in Blackboard, and I'll be posting that in an announcement later this week. Also, your evaluations for the course your evaluations link will be open soon, so I encourage everybody to post their evaluations, and I'll be posting some information about that as well. So I hope everybody has a great week. It has been a great class so far. We're getting into the final few weeks here, so have a great week, and I look forward to seeing everybody in the discussion forums.